We can focus on the changes that recently has been introduced in treating metastatic hormone-sensitive prostate cancer. It's mostly that in the past we treated these patients with ADT, androgen deprivation therapy. In the present, we're treating now these patients with a combination of chemo and hormone therapy. And this is based on 3 studies that has been published and presented over the last 3 years. It's mainly the GETUG study from France, the CHAARTED study from the US, and the STAMPEDE study from the UK. And put that all together in meta-analysis, it shows that combining chemotherapy and hormone therapy in typically patients that has been, as it's called, de novo metastatic disease, confers a significant survival advantage. Take the STAMPEDE study, 22 months, which is unusually long survival advantage for any study that has ever been undertaken in metastatic prostate cancer. So this is now pretty much, I would say, standard. It's integrated into most of the guidelines, in the EU guidelines, in the German guidelines. I'm from Germany. And so I would say, yes, 60-70% of the patients will get that. There's some caveats though, so we're not quite sure. Does every patient benefit from that type of treatment? At the end of last year, the CHAARTED study has been reevaluated in terms of high volume versus low volume disease. And it turns out that low volume disease patients, which has been actually the minority in that studies, do not have a survival advantage in that setting. It's a little bit tricky to define what exactly is high volume and low volume disease. It's number of metastases, location of metastasis, basically. But so it's not yet completely defined, but I would say yes, by and large, it's now the standard of treating metastatic hormone-sensitive disease. That's the main focus. Everything else is, in terms of how we treat metastatic hormone-sensitive disease, pretty much the same.